Good morning, everybody, and thank you for this lovely program and this lovely session we're going to have today. I'll be discussing on some of the innovative approaches of how to handle community eye care, and which can be incorporated in your practice to help you screen out patients better. So there are three focus areas: remote screening and diagnostics, delivery of remote eye care in real time, and monitoring of capacity of global eye care. So just a few machines I'll be going through which can be seen. So we have to see basically innovations to improve the remote screening and diagnostics through visual functions, testing, portable anterior segment imaging, and cataract diagnosis, and fundus imaging. These are the key areas that we normally see for comprehensive eye screening, which can be done through teleophthalmology as well. So a visual field testing analyzer like a Titmus V4 analyzer, which can do multiple functions. Check your visual acuity, your depth perception, the color vision, which can be giving an indication of the optic nerve health, the foreas, and the peripheral vision. Along with this, the Visualite Master can do all these functions and also do a macular function analysis through an Amsler grid, as well as check your astigmatism and your contrast. The peak test can be very comfortably used, and anybody can simply learn how to use it. It's a portable eye examination kit, a smartphone-based tumbling e-chart, and SimSight, which gives an indication to the patient how the vision is and how vision could be post-cataract surgery, along with color vision and contrast sensitivity assessment. LVP has frugal innovations in folding phoropter, which is a low-cost paper-based screening device for refractive error assessment, as well as the novel pediatric perimeter, which measures and quantifies the visual field for kids between 3 to 6 months of age. Anterior segment imaging, now there are various tools in the market available. Some of them initially was Forus, which had the diffuse anterior segment imaging for the diffuse anterior pathologies, as well as dry eye analysis and meibography. And a handheld table mounted can be, and even an AR can be available along with this anterior segment imaging. So Remedy also has come out, and there are definitely many other players now in the market which give you portable handheld devices, which can be used to give a very clear image through the smartphone itself, which can be sent through cloud or Android-based systems into your EMR software, so that you can do teleophthalmology screening at your doorstep. Anterior segment diagnostics also includes glaucoma analysis, the eye pressure being the integral part, checking for the corneal thickness and the eye pressure through various devices, the eye care and other devices like rebound tonometry, and as well as Perkins, which is application-based tonometry, and home IOP monitoring devices are used in the Western population very commonly to evaluate their home IOP monitoring and the diurnal variations. Anterior segment, the Indian innovation of the Dix Pro, which is a smartphone-based gonioscopy, can also be utilized at a peripheral center, which can image and give you the angle structures and the pathology. The visual field analyzer, which has been done now by various companies, which is a very smart and very accurate analyzer, which has a good reproducibility and is comparable to the gold standard machine. And the advantage is it's easy to do and can be done at the doorstep of the patient at your screening device, and the reports can be sent through the EMR to you. The Pupil device, Pupil Plus, which measures and quantifies pupillary and neurological responses to light stimulus, is a useful anterior segment diagnostic tool. And coming to the fundus, because the diabetic retinopathy screening glaucoma analysis is incomplete without the use of non-mydriatic fundus camera, because we cannot, because of the technical issues in dilation and time spent. So a non-mydriatic based fundus camera is in essence. So the optic nerve function, the optic nerve analysis, as well as the macula and posterior pole can be imaged very comfortably through handheld devices as well, which are now smartphone based, and they have an AI based algorithm which can tell you the diabetic retinopathy and can be useful in evaluation. The MI RETCAM is also a novel technique which is now used for not just DR screening but also for ROP screening, and it's a very useful machine which it has a slight learning curve, but once you get a hang of it, it's a good machine to use by a technician, and you can be certified and can be used readily in your peripheral teleophthalmology screening practices. the open indirect ophthalmoscope, a portable high-quality mydriatic fundus camera, which is also can be 3D printed, and software algorithms are there for diagnosis, and also it's AI-based, which helps in further deep learning. So there are numerous devices available, and everything has its own benefits. So you can choose the one that's available and is affordable. And this is a very interesting technology which was published 2019. And this is a technology, this is a teleophthalmic slit lamp. A slit lamp which is robotized with precision stepper and servo motors to motorize all the slit lamp functions. So here you can see at the base hospital, the doctor is analyzing these reports, and the patient is sitting with this proper chair-based model, and through the help of robotic system, the anterior segment can be imaged very, just like examining the patient at your own very clinic. So it can be done remotely via internet, and 3D viewing further helps in enhancing the depth and checking the angle structures. So real-time screening can be installed in primary centers, and these ophthalmic slit lamps could be one of the ways in which vision technicians and volunteers which are present there can be seen, can be using and suggesting anti-segment pathologies, post-ops, follow-ups can be done similar ways. And though there's an initial cost to it, but on the long run, if it's taken care of, it's a good economical tool. So there are various variables and effects which are in teleophthalmology, but overall, long-term wise, teleophthalmology is the way forward in tackling various comprehensive eye pathologies from glaucoma, cataract annulment, as well as diagnosing diabetic retinopathy. So data has to be organized, communicated, updated, analyzed, and very important to be secure and accessible anywhere by the treating physician. And finally, we'll be coming to the role of AI, where the further speakers will be taking care of the AI part. And so basically, technology is here to improve your surgical skill as well. And virtual reality, now we're using 3D systems everywhere, and immersive surgical simulators like Help Me See have really helped young ophthalmologists come up and enhance their surgical skills before doing a real surgery as well. Thank you very much.
Thank you very much, Dr. Vaibhav. Take the questions at the end. Our next speaker is Dr. R. Venkatesh. Dr. Venkatesh, on this side, please, needs no introduction. He is heading the Arvind Pedichery and has picked up the Mega Award at the ASCRS for his green initiatives at the hospital. So over to Dr. Venkatesh from the Arvind. I request Dr. Debashish to please join us on the dais. Please come, sir. Yeah.
Thank you, sir. Thank you for the kind introduction. I'm just going to share with you some of the things which we do towards making our care green, and I'm sure many of you do in your day-to-day practice. So it's a kind of a race with some frugal innovations. So I'm sure you all know about the Sustainable Development Goals, and if you see goal number 12 and 13 is so important. We have to be very responsible in consumption of whatever we get from the market, and the 13 is the climate action, which we are all worried, the change which is happening in the world. So this Lancet came some time back. It said climate change is the biggest global health threat of the 21st century. And Lancet again had another issue saying that tackling the climate change could be the greatest global health opportunity. So there is a threat on one side and an opportunity for us on the other side. So I'm going to share with you some of the practices we have seen as opportunity back at home wherever we practice. So I'm based in Pondicherry. So if you take these WHO guidelines, if you can follow some of these meticulously in your practice, I'm sure you can be a part of a climate warrior. So one is energy efficiency, whether how you're going to be efficient or having a good green building design, getting energy from alternative sources like wind and solar, and transportation, which is a key part to be taken care. Not only the transport of your patients, but also your staff. Can you have them within the campus? And then about food waste, how you properly segregate and recycle waste, and finally on water. So in general, we can put this into two buckets like this, in general and in service design. So whenever we are talking about general things which are practically applicable, now if you are going for a new facility, you can go for a green building. Now there are amazing engineers and architects who do excellent green building where we can have very good ventilation, very good lighting in the daytime, so you don't have to use electricity, and a lot of things on how you are going to do, LEDs, your energy efficient fans, your higher end air handling units, all that which consume less energy. And then definitely putting up solar panels, and I'm sure there is a big way government is supporting for this. And wherever possible, if you can house your staff within the campus, you can reduce a lot of travel of your staff. And more importantly, there is equipment maintenance, which is a key sometimes. If you give a priority to that, your machines and slit lamps will work for years together without much issues. But I'll focus more on the service design, how we reduce carbon footprint, and how we optimally do a lot of reuse and recycling. So whenever we talk about reduce, we always think being very rational in consumables. It's not only that. It is reducing whatever possible from your side, being more frugal, reducing the number of visits the patient comes. We know a patient has to come several times to the hospital just for a cataract surgery, a pre-operative workup, during the surgery, post-operative follow-up. Can we do telemedicine? Can we do telemedicine like what Vaibhav was highlighting? So things like that also is MR. So how you reduce paper is having a good electronic medical record. Now recently we did a work comparing EMR versus paper, and we found that paper is it is more carbon friendly than EMR. It was very surprising because EMR involves a lot of systems, a lot of printers, inks, and then printing of prescriptions and all that. But paper didn't have that much of a carbon significance. But what we also understood that if you can generate your own electricity, then EMR is equally good as paper. But that is more important, how we are going to generate electricity. And standardizing procedures are very important. Now, whatever possible, if you do it in an assembly line process, you can definitely take care of this. And I'll just touch upon some of the things which are highlighting about reuse and recycling. So whenever there is a design, there are several footprints. So wherever possible, can we reduce these footprints by having an assembly line process, one person doing one task, and having very skilled staff doing that so that it was utmost quality, wherein you don't have to repeat a visual field, you don't have to repeat a OCT scan or something else. And also you can effectively utilize some of the equipments. So this is, I'll take you inside one of our vision centers because this is something which is close to our heart. We have 117 vision centers across Tamil Nadu and Pondicherry, and each center, they see close to 40 outpatients every day. And if you see, they have two staff. One is called a coordinator who runs the optical medical and also does the basic investigation like blood pressure, blood sugar. There is a remedio on the doorstep, no financial interest in this. Image is taken, and within 30 seconds, your AI is done for diabetic retinopathy, glaucoma, and ARMD. It's uploaded into the electronic medical record, and then the patient moves to the inner cubicle where an optometrist does the refraction and does some basic investigations. So basically, these centers are within 50 to 60 kilometers from the tertiary care center. They are 500 square feet facility. Now basically trying to reduce the travel of the patients. So 90% of the patients are taken care. An applanation is done. All these information is entered into the EMR, and finally a telemedicine happens. So every day in Pondicherry, we see 600 outpatients through centers, and throughout Aravind, we have seen almost 1 million outpatients last year. So they don't have to travel. And what we saw, interestingly, during COVID time was, significantly these centers did very well. If you see this data, they were almost seeing 80% of the patients during wave 1 and wave 2, when you had lockdowns, whereas the tertiary hospital were only seeing 40%. So if you have centers in semi-urban rural area where people need not travel, they would really enjoy that. And we looked at a lot of things, and we also looked at how much of patients need not come to 90% need not come to the base hospital. So this is a calculation we did and published, so much of trees you can plant if you can reduce their travel. And we are looked at two models during COVID time. One is doing the same day surgery for vision center patients. So their preoperative workup is done in vision center. They come only for surgery, postoperative follow-up in vision center. And then this postoperative visit is for our paying patients and free direct. They go next day to vision center. So these two things we started during COVID, and we found a significant reduction of travel, and this was equivalent to planting 2,000 trees. No, these are all fully grown trees. So these are calculations made on life cycle assessment. So significant number of people are ready to go to vision center the next day for follow-up. They don't want to see a doctor. They are happy to go somewhere near and have their treatment done. So this data was interesting, like in 21 when COVID was slightly reducing, 22 and 23, almost 40% of our paying patients and 70% of our free direct were happy to go to vision center the next day and even after 1 month. So whenever we talk about surgery, these processes are very important, and you need to be stringently consumables and all that we have to take care. But this is an interesting work we did some time back. It's called life cycle assessment again. We looked at various things we use in the operating room, and many of you practice like this. And if you see carefully the last two, which is the disposable ones, if you can carefully segregate like the video you see, thick plastic, thin plastic, paper, slightly more dustbins, but if you can do that, you can make a significant revenue from this waste. So only at the end of the day, all these waste, they go. So all the other things which normally you follow, CSST or washing of your gowns and all that, but this proper segregating of waste can significantly reduce your carbon footprint, which we published. And we said in US, it's like running 500 kilometers, whereas just 25 kilometers back at home in Aravind. So that much of difference, 1/20th difference you can see. So there the waste is 20 times higher, and infection rates are almost same, which is, we are all worried about infection rates. So this is just to show you what happens in Western world. Normally in our ORs, we don't have much waste. So there's one phaco case, this is in David Chang's operating room, versus 100 cases in Aravind Pondicherry. So that is the way, if you can segregate, you can properly reduce your consumables, recycle certain things properly, most of you can achieve that. This is just to show you the waste categories we do. By doing this, it generates almost 50,000 Indian rupees every month in Pondicherry,